Hi, it's Jason from BodyWorx Physio. We're just going to do a quick video on some acute movements that you can do for acute stroke, just to make sure your relatives' arms are still moving. Now always make sure you check with your treating doctor or physio before you're doing this. So this is just as an assistance or an extra bit that we're doing with one of our patients. So we thought we'd put it online just so you can see some of the things that we're doing with them. So a lot of the time in stroke, they'll need a lot of support on the affected side shoulder because this can sublux or dislocate. So always make sure when they're sitting and that the shoulder is supported. And the same thing when you're doing any movements or stretching with them. So the first movement we're going to do, we're going to support underneath their elbow with our hand and shoulder and just gently move the arm backwards and forwards. Always make sure you ask them and ask them to tell you if it hurts when you're doing any of the movement. It's normal that they're going to feel a bit of stretching sensation, but as you can see, I've got their arm nice and supported. Our next one, while that arm's nice and supported, we're going to grab the wrist and then just gently do up and down with the elbow, straightening all the way out and bending all the way out, nice and gently. From there, we're then going to do the wrist, so we're going to gently pulling their wrist back and moving it forward, pulling it back and moving it forward, just nice and gently, then gently turning the wrist out and turning the wrist in. I've still got my left hand down there supporting the elbow so that we're supporting the shoulder. Then we're just going to do their fingers, so just gently pulling their fingers back into extension and then bending them, pulling them back and then bending them. Now depending on how much movement they have, you can then pop your hand inside there and say, can you squeeze my hand for me? Squeeze, 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 and relax. And again, squeeze, 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 and relax. And if they've got extra movement, can you lift your arm up and back down? Push it down into my hand, lifting it up, good, and push it down into my hand, good. So those are the main ones we're going to do for the arm. Next up, we're going to move down to the leg. So what we're going to do, support underneath the knee, hold underneath the heel, and just gently move the knee up and back down. And what I like to do is say, can you push out into my hand? So try and straighten your leg out, that's it, good. And pull it up, good. And push out into my hand. So if they haven't got very much movement in there, you might need to do most of this movement, but as they get more movement returning, they'll be able to help you do this movement. Pushing, and pushing. And then last up, we're just going to do some stuff with the foot. So just pulling the foot gently up and pushing back down into my hand, try to point your toe. And they may not have a lot, it depends how bad their stroke was. Good. Just like that. Okay. So if you can run through those really simple exercises, remember, check with the treating physio and doctor to make sure it's okay. But this is just a really nice, simple way that you can help them just to make sure we get that range moving and through there. Remember, if you do start to notice any contractions starting to form in their arm, especially where their arm's getting stuck, make sure you talk to the treating doctor or the physio to see if there's anything they can do to bracing or to help prevent those contractures getting any worse. Any more questions, you can give us a call at BodyWorx Physio on 4952 7033. Thanks.